Good morning, dear colleagues and ultrasound patients. I am Riccardo Darold. I am a critical care nurse working in a level 1 emergency department nearby Torino, northwest Italy. Today, I will relate about the state of art of nursing ultrasound in Italy, as long as it could be enriching for all the scientific community to put in common training strategies between colleagues from different nations. Just before getting to the heart of the speech, I need you to know how nurses are trained in Italy. As you can see, the diagram resumes that in Italy, nurses receive a bachelor in nursing after 3 years of both lectures and apprenticeship. Once gained a bachelor, a nurse can attend postgraduate training, usually about specific clinical subjects or care areas. Otherwise, a nurse can attend the laurea magistrale that is intended to confer the Master of Science in Nursing. To complete the academic career, a nurse can attend also the PhD or second level masters. Well, counting on a complete career through all these 10 years of possible study, at the present day, only in the very postgraduate phase that you're seeing flashing in the slide, a nurse can specialize on ultrasound. And that happens because in Italy, nursing is a relatively young profession, used to be subordinated to medical professionals, still with limited autonomy at the present day. Therefore, there is not so much attention for nursing ultrasound. And also, in Italy, there is a legislative gap that prevents nurses from using ultrasound as a diagnostic tool, as the most of the patients and the population sees it. That is because practitioners and doctors are traditionally in charge of diagnostics and not nurses. And this means that the ultrasound probe is held fast in the doctor's hand. That's crystal clear. But even if nursing ultrasound in Italy is a new aspect of profession, nurses are improving using it and we totally encourage its employment. Not only because the facts say that ultrasound guided procedures are less harming, lead to less complications, and are much more cost effective, but because many scientific publications advocate nursing ultrasound, as it seems that we, the nurses, when well trained, are as good as practitioners and doctors in POCUS. So, notwithstanding the non diagnostic purpose of nursing ultrasound, but its focused implementation to the health problem, according to the evidence based nursing, a nurse can easily use ultrasound, improving his nursing practice, for example, by using it to place a peripheral venous catheter. As you can imagine, actually, ultrasound applied to the vascular access is one of the most widespread use of nursing POCUS in Italy. As well known, ultrasound make it easier to get an IV line in a difficult access patient. But if we see beyond, there is more. We encourage the use of ultrasound in common patients for helping us in identifying and hiding complications, for example, a deep venous thrombosis. And specifically, for example, in arterial blood samples or arterial cannula placement, to avoid painful accidental nerve puncture, or again, avoiding multiple blind attempts. Apart from that, nursing ultrasound in Italy is today linked to the concept of early recognition of nursing problems that are usually evaluated through clinical and traditional signs and symptoms in order to be earlier, faster, and more appropriate in treatment. The principal settings where nursing ultrasound is performed are emergency departments and intensive care units where usually an ultrasound is always at disposal. And therefore all the health issues evaluate through POCUS often belongs to the critical care area. For example, we usually combine the traditional bladder volume calculation and the inferior vena cava collapse index to estimate qualitatively the volemic state in an holistic view. The typical elderly patient that comes to the ER dehydrated and oliguric, you better know if he's not urinate because of an acute kidney injury caused by lipid loss or because of his giant prostate. So you check the bladder and collapse index, and usually if bladder is deplete and collapse index is more than 50%, IV liquids are, of course, recommended. But of course, if the bladder is replete and IVC is at normal or even augmented range, you better think of something else. This fast and repeatable evaluation actually helps the patient even just for avoiding a bladder catheter for free. Then in shock room settings, focused assessment sonography for trauma is more and more provided by nurses, especially in suburban or spoke hospitals as the one in which I work, when maybe a radiologist is not immediately available or simply clinicians are not used to perform ultrasound exams. In this case, as FAST is a pure technical non-diagnostic procedure, the nurse can be a game changer. According to Advanced Trauma Care for Nurses guidelines, a positive FAST exam in an unstable trauma patient suggests to rapidly transfer this patient to the nearest trauma center, even without a second level diagnosis strategies such as a CT scan. Last but not least, inspiring to the EFAST, pleural ultrasound evaluation is spreading in triage setting to rule out pneumothorax in acute dyspnoic patient with atypical chest pain. We know that the ultrasound diagnosis of PNX is accurate even more than X-rays sometimes, but it is necessary to spend several minutes looking for confirmation finds as the lung point or barcode patterns. Otherwise, just looking for A lines, a triage nurse can easily stratify risk and as triage is intended and send the patient to the correct area of treatment, surgical or internal medicine. So these were the main applications of nursing ultrasound in Italy. As told, here POCUS is slowly diffusing in nursing community as the actual opportunities of ultrasound implementation are uncountable. In the future, we hope to increase the nursing ultrasound policy and enforce its use to many other possibilities, as Professor Pinto advocates and shows, for example, the correct nasogastric tube placement evaluation or the intracranial pressure qualitative study through the optical nerve sheath diameter. I've been pleased to be hosted in this occurrence of sharing between colleagues all around the world, and I'm of course at your disposal in case of an international joint nursing ultrasound commission. I give you my best regards, wishing all the best in your work. Thank you and goodbye.